Families in Lanark County are struggling to cope while raising their severely disabled children. Some languish for years waiting for a group home spot. Others exhaust their savings and ruin their health and relationships.
Severe autism and an epilepsy disorder that's called Lennox-Gastaut syndrome. Nonverbal, I feed him. He wears diapers.
He's total care. We've had CT scans, MRIs, and found out he's missing part of his cerebellum, which is the back part of your brain.
The fatigue factor. We're tired. We're tired all the time.
Later this morning, social service groups in Eastern Ontario will announce that they are stepping up their efforts to get more help from the Ontario government. Hallie Cotton spoke with families for whom this is more than just politics. Hallie, good morning.
Good morning, Kathleen.
I think what really struck me was the final comment. We're tired. We're just tired. So tell me who we're going to meet this morning.
3 different families who are at different stages in their struggle to care for their severely disabled children. The voices you just heard there, Laurie Gauthier, Jennifer Nicholson, and Kathy Hogan, they all live south of Ottawa in the Smiths Falls, Perth area, and all 3 have sons who've needed a lifetime of extraordinary care.
Yeah, and we just got a sense of that from the voices I heard. Tell me about the kinds of disabilities the boys have.
Well, Jennifer's 9-year-old son Tegan is severely autistic and suffered from out-of-control epilepsy and until the family was able to help control that by restricting his diet. You heard Jennifer say he can't talk, he wears a diaper, total care. Laurie's 15-year-old son Cameron has an extremely rare disease, one of just 5 people in North America with it. He is legally blind, also has seizures. After he hit puberty, he became self-abusive in that he bangs his head in his frustrations. He doesn't sleep more than a few hours at a time. And Kathy, finally, the woman who talked about being so tired, her 21-year-old son Ty is severely autistic and has obsessive-compulsive disorders. And Kathy was telling me that other parents of much younger autistic kids ask her, does it get better? She says,
you think you have a behavior under control and a new one crops up and you get that one under control and the old one crops up. It's a continual thing.
Ty also has a disorder called pica, which compels him to eat inedible objects. And just to give you an idea, last year he spent 10 days in hospital with a perforated bowel after eating a sharp piece of plastic. The point is, he still needs constant supervision, and he's a full-grown man.
Yeah. So tell me what the issues are here.
Well, it's a multifaceted problem, as I'm sure you understand, and it's made worse by red tape. The financial support for families trying to cope on their own is simply inefficient. And, as you've been hearing on the news, wait times to get severely disabled children and adults into group homes is very long. Here's Laurie Gauthier.
You're on this waiting list, and you're waiting and waiting and waiting and waiting and waiting some more. And anyway, I got frustrated and fed up, and I called the ombudsman, and I said, this is ridiculous. To be waiting, and we still don't know. Unless somebody dies in Lanark County, you don't get a bed.
How does that make you feel to know that it requires some
It's awful because you're on death watch all the time, which is awful, but you're not hoping for somebody to die. And then even if somebody dies, the chances of you getting that spot are slim to none because you've got all of these other people waiting.
According to social services agencies in the Southeast region, the number of families on the waiting list for a residential spot went up 30% since 2008. So to put that in real numbers, that's 427 families. The demand for day programs increased by 50% to 231 families. Now, one of the reasons for this jump, Kathleen, is our aging demographic. If you think about it, elderly parents who back in the 1960s and 70s decided to keep their disabled child at home with them as opposed to putting them in an institution are now finding it simply too much.
And just describe, Hallie, the impact, the real life impact on the families you met.
Well, that's where this story takes a bit of a twist, Kathleen. I first met Kathy Hogan 4 years ago when Ty was just 17, and at that time she was nearing the end of her rope with exhaustion and depression. Ty had been on a waiting list for a residential spot for years, and things got so bad that Kathy and her husband Wayne considered quitting their jobs and moving to Alberta, where they say there was more support for families like theirs. Then Kathy got the call. A group home spot for Ty after more than a decade on that list.
This news was so absolutely life-changing. I can't even begin to describe what a good feeling it was to know that Ty was going to be moving into such a great group home. And my husband and I just sat there that evening and looked at each other and just kept saying, wow, wow, wow.
Ty's been in that group home for just 1 week now, Kathleen. Kathy said she doesn't know what to do with herself. Her elation, though, is tinged with some bittersweetness because every time she shares the news with another family like theirs and their very close-knit community, she knows they're thinking, well, what about us? Yeah. And that's a question Lori's been asking herself for years. But you remember she referred to that call to the Ombudsman's office? It seems to have paid off because a spot in a group home in another county has been earmarked for her son Cameron, although she did caution me that the province hasn't signed off on it yet. So I asked her, is she worried that that might get snapped up by some other family in crisis?
No, because I keep asking and asking. And we met with them and they said, no, we're going to hold it. And I've talked to the ministry. I said, you sure this is going to go through? Because at this point, I think I'd be a little devastated.
So there is movement on the wait list, Kathleen, when someone dies. And just so it's clear, it's not about how long you've been on the list. It's about how dire your family's crisis is.
And let's talk about the families, or in particular, the relationships and the way I'm sure they must suffer under circumstances like this.
Absolutely. Kathy's first marriage broke up over it, and Lori explains it like this.
You've really never had time with your spouse. We went away for the first time by ourselves in February for my 40th birthday, and we hadn't been away. I don't even know the last time we were away. And it was amazing. And you know what? We didn't make it down, because we went with a group of 24 people. Didn't make it down to the pool. Not until noon. And I said, we slept. We slept 13 hours one day.
Jennifer Nicholson, who's got the son Tegan, she and her husband needed counseling to make it this far.
When you have a child with disabilities, your focus yourself as the mother is on the child, and whatever I can do to make my child's life better, and everything else is wayside. And you don't have a self anymore, so let alone you don't have a relationship. So I think that's a big part of it. And then for him, a lot of it was how do I deal with this, and be the provider, but it's like you can never provide enough. So it's two people going separate ways with entirely how they feel and never ever getting even the time to connect. So it forced us to sit down for an hour.
Hallie, added to all the stress that we've heard described so far in dealing with a child with disabilities, not just the emotional and physical stress, but there's a financial burden too.
And all three of the mothers I spoke with were very clear on that point. Kathy pointed out that the support drops off dramatically once her son Ty turned 18. She calculates about $7,000 a year less in support. Jennifer just finished her taxes like many of us did. She calculated the gap between what the government support provides and what they need to care for Tegan is about $12,000 a year. And here's Lori's plight. She's worried about affording college or university for her two other kids.
We make enough money. We're income precluded for everything. So we're the working poor is what I like to call it. So we haven't been able to save for their schooling. So now what am I going to do? But I'm not going to get any OSAP or anything. We'll have to go into more debt to send them to school because all of our extra money has always gone to Cameron.
And so, Hallie, what does the Ontario government pay for here?
Well, it pays for the basics, but only if you're successful in your paperwork applications, which are piling up, according to the women I was speaking with. Lori says there are grants, for example, for one piece of Cameron's mobility equipment, but not two. There is money for overnight respite care for Tegan, but only one night every 2 weeks. And another example, Jennifer receives a $35 a month food allowance for Tegan. He has a very, very special diet, but his supplements alone cost $400 a month.
I don't have to buy clothes for myself. They're donated to us. Our kids' clothes are donated to us. I've been in the chiropractor with Tegan, and I had somebody leave a donation to have several of his visits covered anonymously. Gift certificates people have dropped off for the grocery store, thankfully.
The community held a fundraiser for the family last year, but you can really tell that it bothers Jennifer to tell her daughter Zoe, her 5-year-old daughter Zoe, that she can't take swimming lessons like other kids.
Yeah, it's going to be so tough. Hallie, if you're a disabled kid in a wealthier family, you're going to get more resources?
Yes, and maybe your child is going to do better, have more life skills. Here's Jennifer once again on really the agony of not being able to provide therapies that might make Tegan's life better.
Terrible. Like, we had seen a doctor a few weeks ago, and, the suggestion was because of the seizures and, lack of oxygen to the brain and some other things, they thought, hyperbaric oxygen chamber could be really, really helpful for him. I can't afford groceries, but you want me to do hyperbaric oxygen chamber, and nobody's going to cover it. It could be one step in, maybe having words, being able to speak. It could be the step that, pushes them into complete being potty trained. I don't know. I probably won't know, because unless I maybe do another fundraiser and raise the money to do hyperbaric oxygen, it's not going to happen.
So 3 different families of different circumstances, but they all want to see improvements to the system, if not for their own kids and their own families, then for others who are following in their, really difficult footsteps.
How great they were willing to talk as well, because it's obviously difficult to live with, but difficult, I'm sure, to talk about as well.
Very difficult, but they do see it as part of the advocacy that they see they must do for their own kids.
Hallie, thanks.
Thanks, Catherine.
We'd like to hear your thoughts. Does the provincial government have an obligation to do better for families like these with severely disabled children? Ottawa Morning at cbc.ca, at cbc.ca, at cbc.ca, at